Hello, my name's Nicola. I'm one of the radiographers at North Tyneside Hospital. You'll be getting sent for a colonography scan, which is a specialised scan to look at your bowel. This will involve you receiving a drink through the post with some specific instructions and a diet plan. Please be aware that this could either be sachets or a bottle to drink. This will help to clear your bowel for the examination. When you arrive to the department, you'll be greeted by either a male or female radiographer or a radiography assistant. If you have a preference for your scan, please let us know prior to your appointment if you would like a male or female radiographer. You will be asked to change into a hospital gown, normally to remove from the waist down. You will then be guided into the CT scan room. We will then ask you to lie on the scan table and we will run through all the safety questionnaire and we will make sure you've taken all the preparations ready for your examination. So we will insert a cannula into your arm or your hand to give you a drug called Buscopan. This is a muscle relaxant and it helps us achieve better pictures and can help with the cramp that you might experience during the examination. You may receive some contrast, some X-ray dye through the needle in your arm. This highlights anything in your body with a blood supply and can give us more information on your scan. We will then explain the examination before proceeding. We will then proceed to insert the tube into your bottom. This is a very thin and flexible tube. It only sits in your bottom around 10 centimetres deep. It will contain lots of jelly, some lubricant on the end to make it as comfortable as possible. It may be a little cold. We will then inflate a small balloon on the end to help keep this in place, so you might feel a little bit of pressure in your bottom. We will then proceed to insert a tube into your bottom. The tube is connected to a machine which will introduce gas to inflate your bowel. We need at least 2 litres of gas in your bowel to start the examination and to obtain diagnostic images. Throughout the examination, the tube being inserted into your bottom can trick your body into thinking you're going to the toilet. Don't worry, you won't be going to the toilet. If anything does come away, there is a bag on the end of the tube that'll catch anything, so don't worry. This test will require you to lie on your back and turn on your sides to fully visualise your whole bowel. The examination normally takes around 15 to 20 minutes, after which you'll be able to use the toilet facilities if needed. You will then be offered a hot or a cold drink and some biscuits. You will then remain in the department for around 15 to 20 minutes. After you've finished your hot drink, your cannula will then be removed. You are then free to go home and proceed to eat and drink as normal. The results normally take around 7 to 10 days.